Hi everyone, welcome to Self-Balance Live. I'm Szenan-Balance from Self-Balance, the acupuncturist. Now today's topic is migraine prevention. Migraine prevention, right? So we talk about migraine prevention. How to prevent migraine, right? I just need to turn on my light in front of me. Just give me a minute. Ooh. There we go. Right. Okay, if you're up in here and watching this live video, please help me to share this video. Give you a thumbs up first. So thumbs up first. Then say hello to me. Then tag your friends, your family, or if you're an acupuncturist, tag your colleague into this live video. We're gonna talk about migraine prevention. How to prevent migraine, right? How to prevent migraine. Then the last thing that you should do, please help me to share this video. Okay, share this live video on your Facebook page, on your profile. Thank you. Now, to be very, very honest to you, there are a few actions that you need to take if you have migraine. Okay, the very first thing we talk about what causes migraine, right? Then the real cause of it is we actually talk about not real cause because there's unknown that reason causing migraine, but really we were talking about the trigger, what trigger migraine. So that become very important because if you suffer from migraine or your patient suffer from migraine, then you need to find out what trigger your migraines. Then avoid those things. Avoid those things. So you need to learn. You need to figure it out. Okay. If you're not quite sure how it happened, then of course we can't find it too. You can't prevent it. Okay. You 100% positive you can't prevent it. Okay. If you want to avoid it, you need to find out the trigger. Triggers are very, very important. Okay, for example, if you find that the lights that give you trigger your migraine, then you need to avoid it. If you find out that the stress, then you need to do stress management every day. We're talking about every day, okay? Then if you find out that dehydration, lack of water, then you need to keep your water every day because this is the only way to prevent it, right? Rather than wait for it to come and then we start treatment. So no, don't do that. Okay. Now something that you can't prevent, right? Pregnant. If you want to have a baby, then you get pregnant. But can you prevent it? The headaches coming? No, you can't. That hormone change trigger the headache, trigger the migraine, and you can't. And in this case, you move to you actually go to the acupuncturist, the Chinese herbalist, to deal with this pain, right? Because you're not going to take any medication, right? So if you too tired, too stressed, or a lot of different noise, like living in an environment that causing you, or your work shop at your work, that the noise causing you getting migraine, or alcohol, use of alcohol, or smoking, or some certain food, or some smell, or caffeine, coffee. So those things that you can avoid, those things you can avoid. Now work out what trigger your migraine, then avoid them, and you'll be fine. Okay. So this is the first thing. Okay. Then what about the others? Are there anything that we can do to prevent it? Okay. Now, okay, we talk about stay hydrated. Uh, like how do you prevent that not getting dehydration? And make sure you get fluid every day. It's a Now we talk about 8 cup of water per day for everyone, right? There's a research say that they suggest that if you have migraine, for men, you get up to 13 cups a day. I don't know, you know, and for female, not 8 cups, 9 cups. Okay, I don't know how it work it out actually, but there's a saying: drink more than you want. 8 cups, if 8 cups is standard, drink more than you want to avoid it. Okay. If your migraine is causing from you skipping meal, because life busy, some people skip meal, so don't skip your meal. Simple, right? That's very simple. Okay. It's easy to say than doing, right? Because life's too busy. And hi Eric, how are you? That you may not be able to just say, oh, okay, I will keep all my meal, you know, uh, because sometimes it's impossible, depending on what you do, depending on what you do. Okay, how you manage your time is important. Okay, I make sure I get lunch, because I'm lucky because my mom cook, and she bring to the clinic so I can have my lunch. Mm, okay, sleeping. Okay, if sleeping, bad quality of sleeping that lead you to uh, migraine, trigger your migraine, then you need to make sure your quality of sleep. Okay, and it will be hard too. I've seen people that they have kids, you know, and it's very difficult because kids wake up in the morning, at night time, and they come to you, or they cry, or newborn baby, and that's so difficult. Then there is something that you can do about it is, your partner can help you. Your partner should be able to help you with this. Um, what else? Some people wake up because of pets. Cats. A cat keep coming every night into a room. And I think this, I love animals. I'm vegan. I'm not saying that you have to be mean to your animals, to your pets. Uh, but that is something that, like, we put our cats in the laundry room. We had a pet, as a place for cat to be in it, to keep warm in the winter. So we close the door so it won't come into our room. You know, because cat come to your room and scratch the wall and the door and ask you to open the door. So there's something that you can keep the cat away from you. You know, but some people don't because they love cats, you know, and they want to be, if cat needs them, they want to be with cats at night time. I have patients sleep with cats, you know, and I would suggest if that is the problem that causing your trigger your migraine, then you better deal with it. You know, rather than causing migraine, you know, sleeping if the trigger, then you have to find a way to get a good quality sleep. Okay, this is important. Okay. Now, if smoking is the trigger of your migraine from smoking, then you have to stop smoking. Right? And while a lot of people change to the electric cigarette, and they think vaping, right? They go vaping. Yeah, I don't know about this, but I do have patients been doing it for 1 or 2 years, and he got worse. What I mean he got worse is he can't breathe properly. He said the vaping is very, very bad for him. I don't know, just for your information. I have no experience of that. But what my patient told me that is ever since he stopped cigarette smoking and changed it to vaping, vaping, and he got worse, much worse. He can't breathe properly. So you need to consider that if you suggest your patient or you changing from smoking cigarette to electric one, you need to think about it. Is it better or is it bad? Or is it same it's still the same or it get even bad, right? So you need to think about this. The best thing for you is quit your smoking. No electric smoking, no real smoking. Okay, so this is my suggestion. And who can help you? Yes, acupuncture can help you. Acupuncture can help you. Hypnotherapy can help you. Hypnotherapy can help too, right? So you need to understand who will be able to help you with that. And your doctor may be able to help you too. Um, so when it comes to quit smoking, you actually come to like you may get sweet food or things like that. So you want to manage the what's going on after quitting smoking. Okay, you need to deal with all the symptoms. If the stress is really making you sick, it's a main trigger of your migraine, then hey, reduce the stress in your life and learn how to cope with it. It's gonna be very helpful for your preventing of your preventing the migraine. Right, this is important. Right, that yes, we in our clinic we suggest our patient to do emotional daily practice, daily one, daily one. We use all Pono method. Uh, you can go. There's a book called Zero Limits. Then yes, some people do NLP, great stuff. I don't do NLP. I don't know how to do it. So, but I heard about it. A colleague who got NLP, and they share NLP to me. And it's a great stuff. Go for it if you know it. So if the patient know how to do that, suggest them to do that. Hi Veronica, good morning. Video is frozen. Oh, I don't know what to do then. Thank you for letting me know. You who this? Yeah, is it video still frozen? That's not good if it's frozen. But probably that's the way it is. You just need to listen. Uh, I don't know what to do with that. Probably this internet issues. Am I in or in your in? I don't know. But how about other people? It's okay now. Thank you, Veronica. letting me know that. Okay, now what we're gonna do, we're gonna keep going and talk about it. Reduce your stress. Okay, now some people like to listen to music. Okay, some people go for walk. I have patient who say that if you go for uh, we have a lake in here where we stay in here. It's beautiful. The view is beautiful. It's very relaxing if you walk around the lake. Yeah, and you can see bird, chicken in there, duck in there, and maybe fish. You know, and a lot. And it's beautiful. It's beautiful. And she went there, just walked for 15 minutes, not long at all. 15 minutes, and she felt very relaxed. I said, that's good. Keep going every day. If this is the way that you get relaxed, and go for every day. You see what I mean? So this is important. This is important. Okay. Video frozen again. I'm so sorry about that. I don't know how to fix it. It's an internet problem. If you want to change to the YouTube one, you can go to YouTube one. Maybe YouTube is fine. But YouTube is on live as well, or Instagram, Okay, so we have few platforms actually got live video at the same time. I have my clinic page as well. Hi, Carol and Henry. How are you, Henryson and Lydia? Nice to meet you. Thank you for joining us. Thank you. What else? Yoga. People do yoga. If you're a yoga person, I'm not a yoga person. I don't do yoga, but yes, if you do yoga, I patient every morning. In yoga, it doesn't mean you have to go to the gym to join yoga. You can do your yoga at your home. He just do yoga every morning and put on a video and follow the video and yoga move every morning for half an hour. That's it. And he got back pain, and that if he does his yoga, no problem. If he stops his yoga, the back pain come back quickly. I said, well, keep going with yoga every day. This is the prevention we're talking about, right? Then it make him relax too. You know, if that is the thing that for you and for your patient, we provide Ho'oponopono method to everyone. But I'm not saying that everyone need to come to me. When you come to me, you need to do my thing. The only thing that I provide to you. No, I'm putting in there to provide to my patient, and I tell them this is a great way. We have been uh, using it, practice it, and it helped us a lot. Help our patient a lot. If you have your own way, keep going with your own way. If you want to learn something new, here it is. Now, if you haven't got anything, you haven't found anything, keep searching. Okay, seeing something that can reduce your stress, anxiety, or depression. And if you haven't got anything, try our one first. See whether it helped you or not, whether it suit you or not. Okay. When it comes to emotional daily practice, reducing stress, there are many methods. Okay, so don't force you into just one. If it doesn't help you, keep searching. Okay? You don't have to stay with whatever people say this is good, this is good. You try it. If it doesn't suit you, jump to the other one. That is my suggestion. That's how I suggest my patients to. Something that when it comes to management of the stress, something that worked for me, but it may not work for you. Okay, it may not work for you. Okay, like going for a walk, I don't go for a walk. But if you go for a walk and help you, you go for it. Doing yoga, I'm not a yoga person. I don't do yoga. I don't practice. My patients do yoga, and I support them. So keep going. That's it. So you ask your patient or you ask yourself, what would help you relax? Okay. Of course, if you work hard, overwork, overuse your body, then you have to decrease it. You can't just overuse it and then get something to try to cover. That's not how it happens. Okay? This is not a proper way to do it. If you're working too many hours a day, then you have to cut down your hours. Simple as, right? Simple to say, not easy to practice, not easy to do. Especially when you want to do it consistency every day. And the key to success is to do it every day. Like I do. You probably didn't know that I was in the hospital yesterday for the morning, for evening. So I took my friend to the emergency, and it came out about 12 o'clock. But I still do the live video with you today. I still get out at 6 o'clock today, because this is my commitment to you. Do live video with you. I want to do a consistency every day for you, right? For you. I did miss the Chinese live video last night because I was in the emergency, my friend. When you go to emergency, actually, I'll tell you what the real thing is. The main time is many waiting time. You just wait and wait and wait, and you 5 hours in the emergency. The time that's seeing the doctor is about 40 or 45 minutes. That's it. To deal with the things, 40, 45 minutes. The rest of it is waiting time. A lot of people, yeah. That's horrible. But the doctor very professional and very nice, and doctor that's from UK, and the other doctor came is local one, and did both lovely, yeah, professional, and did a skin, ultrasound skin, and I joined in, and they show me what's going on and explain everything. Oh, perfect, I love to work with and see and deal with a practitioner who open mind, who explain very well to patient, and that's important. No confusion, because when it comes to emergency a case, and patient is actually worried, and they stress out, and they're in pain, and the doctor explained very well what's going on, how diagnose and everything. Because before I took her into the emergency, I checked everything. I said, wow, it will be a kidney problem, I think. Because but to be sure, get a scan or whatever to make sure. Okay, you need to do some tests. Okay, we need to roll out something. So it comes to very important. If you're in acupuncturist or Chinese medicines, you need to know, in this state, we need to know how to diagnose properly. We need to know how to deal with patient abdominal pain and back pain. So not every back pain and abdominal pain would just simply put needle in, because you need to know what's going on inside. Because this patient have back pain and stomach pain, and vomiting and dizziness, and there is not an injury, and the pain is in the kidney area, and you push it, you can't feel it, you bang it, you feel it, and it's on the kidney. So we want to know what's going on with the kidney. So there's a lot of tests that it can actually help us to diagnose properly. Okay, we're not just talking about, well, just put some needle and reduce the pain, that's it. No. Okay, you may you can do that, help the pain reduce, but how do we properly diagnose? Okay, now in the old times, some acupuncturists or Chinese medicine, they can just take pulse and give a proper diagnosis. And now, if you haven't got this, just taking pulse and get the right diagnosis, or I can't do it. Okay, so we need to use the technology, okay, ultrasound scan to roll out things. Right, this is important. Well, we're off topic a bit. I'm just saying that consistency is important. Okay, managing your stress, consistency, doing it every day is important. You need to have a tool first, then do it every day. Okay, all right. Now, exercise regularly. Yeah, if you're overweight, you know, if exercise can help you to lose weight, if exercise can um, if exercise can help you relax too, which a lot of people find that exercise should help them relax, you know, so then that's good. Then go for exercise every day. Keep it consistencies, you know. And I do my exercise every day. My exercise is easy. I don't have to go out. I just do it at home. Okay, so I find my way, and you find your way to keep yourself, keep your health well. Okay, so not everyone need to do the same exercise every day. Okay, not everyone. Right? You do have to do it every day, but not everyone have to do the same. So there are a lot of exercise as well. Qigong. People talk about Qigong. Do you practice Qigong? Yeah. I said, well, my Qigong is different with you. Okay? People spend a lot of time with Qigong. So I have busy life. I'm not a person that who do the Qigong. I do different Qigong. Okay. We do sleeping Qigong. When we go to bed, we do Qigong and then go to bed. Okay. So you just find your thing for yourself. Okay. You just find the right way. You know, find a way that is suitable for you. You know, don't have to follow everyone or whoever doing very well on something. Like Tai Chi, we used to practice Tai Chi, but not anymore. I don't do Tai Chi. And if you do Tai Chi, Tai Chi is good for you. Go for it every day, and that's good. My patient asked me, "Can I do Tai Chi? I'm going to learn Tai Chi." I said, "Great, go for it." Always support your patient to go for anything that they want to do, because that might be the answer for them. You know, so don't get your patient to rely on your Chinese medicine or your acupuncture. Okay. Now, let's talk about what let's talk about prevention, right? We talk about prevention. You can do some acupressure point, right? Now, yes, I'm going to show you some other acupressure point today. We talk about liver 3, large intestine 4, and kidney 1, right? Those are the points that you can do when the headaches happen, right? Now, what if there is no headache yet, no migraine yet? What can you do? Yes, you can also do the same thing. Those 3 points. You can practice every day. Get rid of all the tension point around there. Okay. Now, apart from that, there is an easy way. Okay. Remember, I show you migraine for the front, top, side, back, right? So that's an easy way that you can do it every day, right? I do it sometimes. I don't do it every day, to be honest. On that one, that can help you clear your mind. Okay, you become smarter. If you have foggy mind, you have foggy head, and this is a great stuff for you. So get your joint like this. You want to do it on the joint, right? And squeeze it. If you feel sleepy, you can squeeze that as well. Squeeze it very hard. You hold it for 30 seconds to 1 minute. Squeeze it very hard, very hard, very hard, okay? And you feel the pain and tenderness on the joint. And when you squeeze this, it helps your brain, the circulation on your brain, right? It go better. Right? So when you squeeze, and then you change from that. Now this is difficult, difficult here, right? You change that one to that one. Okay. And squeeze again. Put it on the joint, you know, make sure that on the joint. Squeeze again for 30 seconds or 1 minute. Simple, right? Do it every day. When you don't have any pain, this is something that you can do. And every day, if you haven't got any migraine, you know, you want to prevent it, again, we show you the other day, tapping your head. Just tapping like this. And you want your neck as well. Just tap like this. Or you can tap with your fingers like this, the fingertips. Or if you think, oh, okay, I want to be a bit more stronger, especially when it comes to Feng Shi here, you can use this. And I find that using here with this is much more comfortable. And I can do it but stronger. I go down to the neck. Okay? And what else? If you want to do here, and you say, oh, okay, just tapping like this, I want to be stronger. Yeah. Over here. I showed you the other day. Yesterday or the day before. Just like that. Just knocking on your head. It helps a lot. Can you hear the knocking sound? So this is how you can, by doing this on local area. Again, if this knocking on your head, tapping on your head, if it actually trigger your migraine, don't do it. Instead, doing the distal point for it. Okay, doing the distal point. Now, if it help you, then do it every day. Consistency. Okay, consistency is the key to get success. Consistency is the key to make you healthy. Just that you need to eat every day, but eat healthy food. Okay, not the junk food. I have so this is one thing. What did I ever say? Yeah, a patient came yesterday. She was coming for eyes problem. Okay, and headache, pain over here, and causing the headache. Okay, she's very sensitive to food. Okay, and food, some certain food, especially me. Okay, the reason I said that is because when she had meat, I said it's Indian. I said, well, you need to change your diet, and she keep her diet very well, and bowel motion very good, and stomach pain all gone, you know. And when she's bad, she went to McDonald's the other day, and as soon as she had McDonald's the next day, she got bloating, pain in the stomach, and diarrhea. I said, well, you try to keep your diet is pretty good if you cook it yourself. The meal over the lockdown time, she cook every day, and very happy because no tummy problem. But as soon as it's finished and she started to take some takeaway, you know, McDonald's the other day, he said I literally felt it straight away. Bloating, tummy pain, diarrhea. I said, you tested what against and against and against, and your body keep telling you this is not good for you, but you haven't learned yet. You keep challenging your body, you know. So what is the point? Keep putting those junk in your body. I said, well, you know what's good for you. You just need to do it consistencies, you know. Just need to avoid those things. And this patient, the reason I say this is she had a part um, headaches, not migraine, and the headaches affecting her eyes because her eye get worried. It's better. It's better now. So there's a point over here on the Feng Shi. Headaches in here always come to the eyes and causing pain, the headache over there on the neck. This is the point that's difficult to get rid of. As you change your diet, we can put needle in. I did needle, I did acupressure point. Straight away, release it, but quickly it comes. Okay, that's for years. That's for many, many years. You know, it's still there. I said, well, change your diet. And she keep her diet well and do the acupressure point. And Chinese herbs. You know, she's been having Chinese herbs for over 6 months. over 6 months. And we have a re-exam yesterday. And she said, well, this is gone. No longer any problem. We took for months to get rid of this. Get rid of one point that causing the eyes problem as well as headache. And this person, the reason I mentioned about her is she came to me yesterday, then for re-exam, and I gave her more herbs and show her some acupressure point to work with here, and we just some acupressure point around here, and as soon as she did that, and the bury here, and this is important, then we couldn't do any acupressure point on her head at all in the first place. Last year when we did that, she get migraine. She get even painful. She said, well, I can't do it. I said, don't worry, don't do it. What we do instead, we just do, because when treating eyes, I ask my patient to do all this upon around here. I think I showed you yesterday. And distal point. I said, just keep on distal point. Just keep on the point on your hand and leg. Guess what? Consistency is important. She doesn't do it every day. But she did massage her ear, not every day. I said, well, keep encourage patient. Do it every day. Do it every day. If you do it every day, you speed up the process. And she got much better now. But the eyes, all the eye tests normal. She can read far away, pretty good. But when she came to here, started to get blurry. And she came to closer, she can't see anything. All the eye tests fine, no problem in the eye. She just can't see properly. She used to have floaters, a lot of floaters, bad spots, and we help her to reduce to only two small ones on the right eye. Remember, on the right eye. So yes, Chinese medicine can help this, and she got high cholesterol, and doctor get her to take cholesterol. I said no cholesterol pill, because when you take cholesterol pill, you're gonna get worse and worse. Cholesterol out of balance, meaning that your liver, according to Chinese medicine, the liver has a problem. Then change your diet. I very confident when it comes to plant-based diet. Patient, the quicker one, 1 month, the cholesterol back to normal. Okay. Normally, I say 3 to 6 months, depending on how well your diet is, because the liver needs to be function again properly, recover again. So it takes time. Everyone's different, but changing a diet, the cholesterol definitely will help and lower. Get to plant-based diet. Okay, so this is my key to treat cholesterol. I said, well, cholesterol, you don't have to take any herb, no acupuncture. You don't do that, because again and again, I see my patient, she's changing the diet, cholesterol drop to normal. But I still give them treatment. The reason I give them treatment, I say I'm not treating because your cholesterol, but the cholesterol is definitely from your diet. Just change your diet, and I've seen it a lot. It came back to normal. But the reason I give you acupuncture or Chinese is because your organs are out of balance. Or try to bring it up normal. Like I'm treating your back pain, I need your acupuncture. I'm treating blah blah blah, I need this. I'm treating other problem, I give you acupuncture. But doing acupuncture not because if you get better, it's not because the acupuncture or Chinese it's actually because of your organs getting better, because of your diet. Yeah, it's because of your diet. So this is important. Let patient know that changing lifestyle is important. It affects all your health. Are you agree with this? Changing lifestyle, it can prevent your migraine. If you agree with it, please give me some comment and see whether you agree with it or not. Okay, I'm open. You can say, sorry, Szenan, I'm not agree with you, blah blah blah. I'm very open. There's no right or wrong. You have your experience. I have my experience. This is my experience. This is what I see, and I do respect you. Okay. Now, comment down there if you're patient. Tell me what sort of migraine do you get, and what things that do you do that actually will prevent your migraine. And let me know if you're a practitioner and what sort of thing that do you suggest to your patient to actually work for prevention of migraine, right? Stay awesome. That's it for today, and I love you all, and I'll see you tomorrow morning. See ya.